In the last couple of years, more and more younger patients are coming in for facial rejuvenation because the concept of like a liquid facelift, you can lift the face with fillers and volume, is pretty much understood now that doesn't work. So people are going back to lifting the face, and at what cost? Is the scars worth the incision, especially in young patients in their 30s and early 40s. So here you can see the stigmata of the facelift. You can see the scars, the shortening of the sideburns, right? And you can see the distortion of the tragus. The tragus does not look natural anymore because the tragus often is blunted. It doesn't look like a natural tragus anymore. It looks flat and it looks foreshortened. And then sometimes you can have a pixie ear deformity where it pulls down. When you think about it, it's really designed to remove excess skin. You're using a surgical technique designed for older patients with lots of wrinkles in skin on a younger patient who doesn't have any wrinkles. Like this patient here, who is not my patient, but she's sending this. She's only in her 30s, right? And you take the face completely apart like this. Is it really worth the delamination and destruction of blood supply and really injury to the facial tissues when you're so young? A good example is this patient of ours who at age 30 had a deep plane facelift in town here, and she has the scars, but at the same time she did not get the results because in the traditional sense, deep plane or SMAS facelift is really for the lower face and the neck area. It really doesn't address the brows, the eyes, and the mid-face area. So what we do is the ponytail facelift. And scientifically, when I'm talking to doctors on a podium, it should be called endoscopic total preservation deep plane facial rejuvenation. What we're doing is making a little incision here, and we're gonna put a little camera inside, and we're gonna navigate around the nerves and the vessels, and we're in the natural gliding plane of the face so that we're not really cutting into the tissue. We're using the scissor to spread the tissue apart, and then we can expose these vessels and nerves that go around it. So we're not cutting any blood supply to the fat or the skin. And this was published 2 years ago in the Journal of Aesthetic Surgery. It's the most prestigious aesthetic surgery journal in the world, and we had a lead article, and actually has been the most downloaded article in the history of the journal.